Good morning, Mr. Orange. How are you doing today, Mr. Joe? Okay, my name is Nurse Lucy and I'm going to be your nurse today, and I'll be performing Foly insertion today. Okay, but first, before I start, I'm going to make sure I do the proper hygiene. I wash my hands, sanitize my hands, put on gloves. How are you doing today, Mr. Joe? Oh, good. Can you tell me your name and your date of birth, please? Okay, good. I'm going to be telling him what I'm doing, and I'm going to be doing the Foly insertion today. And my patient is right, and this procedure, or this Foly catheter insertion, was ordered by a physician, and that's what I'm doing as a nurse, because it was ordered by a physician. And then as a patient, my patient is right because yes, they need a Foly catheter according to what the physician said. And then patient's writes medication, writes dose, right time, right route, which is insertion into the urethra. Okay, and they write the documentation somewhere else. Okay, so going to make sure that everywhere is sterile. Right now, everywhere is sterile, it's been cleaned, it's dry before I open my kit. I'm going to open my kit this way, one, this way, open it. I'm going to open it. I'm going to open it. I'm going to put my gloves out. All these are sterile. Okay, it's all sterile. I'm going to discard the old one, the initial gloves. I'm going to put them. I'm going to discard them. I'm going to sanitize so that I don't break sterility. I'm going to sanitize so I don't break sterility, and I'm going to be wearing my gloves. Yeah, so I'm going to be wearing my gloves. Okay, I've not broken sterility yet. We'll see. Putting on my gloves. Trying, these gloves don't fit real good. I'm trying to make sure I don't break sterility. Okay. And I'm going to be holding it right in here to this part there. Okay. So everywhere has been sanitized, everywhere is clean, everywhere is. I've not broken sterility yet, so I'm going to be using this. Okay. 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 This is my lube. As much as iodine is as much as I need so that I can get that in. Okay. And so this is my patient. I'm just going to be putting the Foly. Okay. I'm going to make sure I lubricate a lot on this and put it in. Once this is inserted, so it's inserted all the way into the urethra, and then the moment that I see that the pee can flow through, I'll make sure that put the ball in and push some liquid in and put the ball so that it's stays in there, it stays in place. And then I'm making sure before I can do this procedure, it has to be ordered by the doctor. And then before I can stop it, before I can discontinue it, it has to be ordered by the doctor. I can't just go in and discontinue it. It has to be ordered. Both have to be ordered by the doctor. Okay, so for a female, if I'm going to be doing this Foly catheter on a female, I'm going to clean from top to the bottom. I'm going to raise the labia, and then I'm going to clean from top to the bottom. Okay, and then if it's for the male, I'm going to be cleaning from inside out. That's the penis area. I'm going to be cleaning from inside out. Okay, and I already made sure that I already talked about all the rights. I already talked about how the tip of the Foly has to be well lubricated. I'm going to document everything. I'm going to document before I insert. Even after I insert, I'm going to check for if there's any abnormalities, while putting it in. If there's any screen breakdown, there's anything that doesn't look normal, I have to document it. I'm going to document all of my process, everything that I've done, all of my assessment. I'm going to make sure that I document them, patient reaction, any grimacing, anything, any discomfort while I'm inserting. I'm going to make sure that I document so the other nurse can know. So even I'm going to let the nurse know. I'm going to document how much water I inserted so that the other nurse coming in to discontinue or to put a new one knows how much ml of water to put in. So now I'm going to ask my patient if they need anything, call light. I'm going to give my patient call light. I'm going to give them water if they need water, and I'm going to discard my gloves. I'll wash my hands, put all my used item in the hazard bags, and make sure that everywhere is clean. And that'll be all for my procedure.